I was in my late 30s when I was first diagnosed with gestational diabetes. And then soon after that, my second pregnancy, again, gestational diabetes. It was the best thing that was happening to me, having babies, but also the most scariest, especially with the second one, because I had to put injection in my tummy. And then it's only early last year, I had other health complications that led me to emergencies multiple number of times. And then that's how we figured out that I'm a full-blown diabetic patient now. I've noticed that some of the common misconceptions that people have about someone living with diabetes is they're lazy or they're overeaters. Or sometimes when people say, "What did you do?" And sometimes people say, "Oh, you've been eating sugar a lot lately, Geetika. What happened?" Which is not true. It's not just a food-related disease. There are a lot of other factors that play a role into how or why you are diabetic. Genetics, we now know. You may be belonging to a high-risk ethnic population. Gestational diabetes, and underlying health issues. Like, for example, in my own case, I was checkmarking most of these factors, but also because, as I said, my mobility was compromised, and my understanding that maybe after post-delivery, gestational diabetes goes away and all will be fine. So it is definitely not just food related. But as I say that, regardless of that, once we know, I think we can take charge of the situation. Education, I think, is the first step. Awareness is the first step towards moving forward and taking charge of the situation. And the other thing which I feel very empowered and happy to share is that now I know that this is not a trajectory that has to go upwards all the time, or it has to be bad always. As a diabetic patient, you have to be resilient 24 hours a day. I would strongly suggest someone who is newly diagnosed to, first of all, not blame yourself. Take charge of the situation, ask questions, do your research, definitely read about do's and don'ts. And there are a lot of free resources available in the community. Go check Diabetes Canada website. Ask your doctor. There are free pamphlet sections in doctor offices. Use them, take them, read it. And do your best, because you can take charge of the situation.